Well, South Africans are anxiously waiting to hear what President Cyril Ramaphosa will say tonight about the country's COVID response. Almost 18,000 new cases have been reported in the last 24 hours, and South Africa is nearing the 2 million mark where infections are concerned. So how should the President navigate this tightrope between lives and livelihoods? Well, let's speak now to Nehawu General-Secretary Zola Saphetha for what they're expecting from the President. Zola, a very good afternoon and thanks for your time. What is it you want to hear from the President tonight as Nehawu?
On our part, 4 fundamental areas. We expect President to take in confidence the nation about the complacent response strategy to COVID. As you will know, that every time we're caught off guard by waves, as if we didn't know that there's a wave next to the other. So we want to hear him, what he would be saying on a responsive strategy on the complacence is fundamental one, because we have been advising government to learn from each wave and how we prepare for it. So that's the first one. The second one, of course, we want to hear him saying now, differently from what he normally does, that we have secured, not we are still intending, we have secured vaccines, particularly as it relates to Russia and Cuba, as we have been advocates for those, because the Abdal, which is a vaccine that have been discovered in Cuba 2 weeks ago, has been having a 92.8 efficiency. So we want to hear the extent to which they've made progress in that area, Russia, China and Cuba in particular. But the last point that really want to hear him speaking is that how do the vaccine go to people as opposed to people going to vaccine? For instance, now we're in the phase of elders. And elders, you know that they rely more on the pension. So they will not have money to transport themselves from where they are to these centers. So I want to hear how would we change that arrangement and make sure that vaccine goes to where elders are, because we have been making proposal in relation to absorbing and employing community healthcare workers who are family-based kind of interventions. And the last issue is more on Gauteng. As you will know that there are white elephants currently in the presence of a shortage of space and beds in hospitals now, which have proven to be working in the first wave, like your Nasrec hospital field, which is closed down with the necessary equipment in the presence of one hospital having closed because of it was burned down, and the laundry in Christian. So we want to hear him. How would you respond? Because putting harder restrictions really would not resolve the numbers that we have now. Already those ones have contracted.
Zola, if you spoke of your proposals in terms of getting vaccines to people and not people to vaccines, and I can completely understand that, because in the moment you get people out of their homes, immediately they are more susceptible. Just give us a quick idea as to what you proposed. What were your solutions as Nehawu to this?
We are completely clear. We have, as a country in the healthcare system, what we call healthcare workers or community caregivers who are outside now the system, who have helped the nation a great deal in terms of testing in the first wave, and now they are no longer in use. So we're saying that the government can invest more on those, because they interface communities on daily basis, and also bring closer, what we call the committees, local government committees, who are working closer to families.
All right, Zola, very, very quickly, I have to ask you about the Deputy President, David Mabusa's trip to Russia to seek medical treatment. As Nehawu, given all the challenges that you've just described for us of ordinary South Africans and your members as well, especially when it comes to healthcare, what are your thoughts on the Deputy President jetting off to get special treatment in Russia, as many see it?
We don't have that big fuss about that, because we know he went to Russia when he was still the Premier of Mpumalanga, on the basis of the allegation of being poisoned. So he's just making a medical follow-up with those doctors that they have looked into. Our real issue is the 150 million that has disappeared through this community company, which would have contributed immensely to the crisis that we have. So we live to what we think that is critical and matters to the health of our people.
Okay, well, if the other question is, if he is that sick, then should he not maybe just step aside or step down if he's unable to perform his duties in the country at a time of critical need?
It will be a problem for me to make an assumption on the kind of sickness, because it might not be just a serious sickness, because what we are told by presidents is that he's just making a follow-up to his routine in terms of the checkups on the intervention that have been made. So we will not know the extent and the complication of his sickness, as it was not been disclosed.
Do you not have a problem though with this being at the cost of taxpayers, I would imagine?
We have a big problem to those who are looting the state resources using their position that they are holding. Like now, we have a scandal of 150 million, which is supposed to be taken back to reinforce the little we have to respond to the COVID-19 now. Because Mabuza will not have stolen any money. He's using what is entitled to as benefits and out of his pocket to look unto his own service as a person. So it might not have that major implication. So I would not really be focused on that. I must focus on more on those who are abusing power for their own self-accumulation.